And welcome back to Doctors on TV. Mga kasambahay, ang topic natin for this morning, lactation and breastfeeding. Of course, with us, our very special friend from St. Luke's Medical Center and the Medical City, Dr. Cristina-Bernardo. Good morning, Dr.
Good morning again. Natutulala kami.
So, Dr., kanina we talked about the benefits of breastfeeding, both sa mom and sa bata, both short-term and long-term. If there's so many benefits, why aren't all mothers doing breastfeeding? Ano ba yung mga barriers natin?
Yeah, it's good that you mentioned the barriers because one of a part of the infant and young child feeding program of DOH is to accredit hospitals to be baby-friendly. Pag sinabi nyo kasing baby-friendly hospital, they really follow the 10 steps of exclusive breastfeeding. So yun yung guide natin. One of that is to have those policies and trainings in the hospital. Step 4 would be initiation of breastfeeding and non-separation. So yun yung barriers natin. Because before, in those hospitals not yet accredited as baby-friendly hospital, meron pa silang mga nurseries. So, pag accredited na as mother baby-friendly hospital, wala na yung nursery. So, we make sure that when the baby is delivered, the baby is put to the chest of the mother for bonding and for skin-to-skin contact. And then from there on, hindi na nagsiseparate sila. So, from delivery room to the recovery room to the room, magkasama na sila.
Immediate na.
Maganda yun. That should be ideal.
Yes.
Yeah. Ang rooming in description na kasi natin on anytime, even after 2 days,
Tsaka ipapasok sa loob ng kwarto.
Yun ang rooming in.
Pero ngayon,
Rooming in,
after delivery,
yes,
dapat
they shouldn't
dyan
be
na.
separated for more than an hour. For procedures, na pag kinuhaan ng dugo yung baby for any case, not more than 1 hour. So they shouldn't
under anesthesia pa yung nanay. Sige, hintayin mo, wear off.
For CS patients or mothers, when the mother is able to respond within an hour, they should be with their child or baby.
Oo. Usually naman ang anesthesia ng mga mothers ngayon regional eh.
Yes.
So they're awake, no, pero manhid lang downward. So kaya pa rin naman nila with assistance of course.
Awake tayo, diba? Ako when Ion came out, talagang wala na, dito na siya eh.
Oo, we encourage mothers to be awake para ma-experience nila yung mismong childbirth at saka nga they can latch immediately.
May first kiss na kami noon, Doktora.
Yes.
Tumaba siya few minutes before.
Correct.
Oh, before we proceed, Doc JM, we have a question here.
Okay, phoning question from Rhea of Mindanao. Naka long distance pa yata to. I have a child with autism, hindi po siya breastfed. Now I will have my second child soon. Sabi po ng doctor, high risk siya to get the condition. Will breastfeeding help lower the risk of getting autism?
With autism, we don't know how
It's a condition.
But there's other risk for that. There's other benefits for breastfeeding other than just getting. But I'm not sure. Yeah, but I wouldn't
Might
know.
not lower the risk, pero dapat pa rin siya
breastfeed. So I'm not
So,
sure.
kanina nabanggit mo na yung latching. Clarify lang natin, ano ba yung latching? How soon should it be done? Ano bang benefits ng latching na?
Oo, hindi. Kasi for the mother, ang magti-trigger kasi ng milk production and milk letdown is yung paglatch, meaning yung paglagay ng baby's mouth on over the mother's nipple. So, kailangan, hindi basta-basta magpo-produce ang body ng milk nang walang stimulation. So, kailangan ilagay ang baby, no, mag-latch siya, and the sucking of the baby, siya yung magpapaproduce ng milk. So, very important yon. The earlier you do it, the earlier magre-respond yung body ng mother. Kaya ngayon, yung asin paglabas ng baby, don't need to clean the baby, latch ka agad. Tapos ang baby, di ba, meron silang rooting reflex, no? Hindi siya itinuturo. Automatic yon. Diretso, kaya niyang mag-suck, kaya very important na maaga siyang i-latch.
Ayun pala. So wala dapat tayong problema doon sa paglabas ng gatas ng bata. I have this very important question, Doctor. May isang bata doon sa isang hospital before na nakita ko na yung bata hindi nakakadede ng 3 days kasi walang gatas na lumalabas sa mom. So, iyak na iyak yung bata doon sa nursery. Doctora, you mention yung ayaw nyo na ng ganon, di ba? Gusto nyo roaming in na.
Correct.
Ang problema nung bata na yon kasi 3 days na hindi dumidede. So iyak ng iyak, ayaw ng nanay kasi breastfeeding advocate siya. Ayaw ng nanay na padideen ng kahit ano. Ang gusto niyang ipadede is yung tubig lang with glucose. Doktora, ano yung, can you enlighten us with this? Kasi hindi ko gusto na paiyakin ng paiyakin yung bata eh. No? Tapos bibigyan lang ng tubig with glucose. Doktora,
Yeah.
anong mga risk nito at ano yung mga ano ang thoughts mo on this?
Well, glucose water is already labeled as a medication, no? So hindi siya parang dapat binibigyan ng glucose water as well. So for the first 3 days kasi misconception na parang dapat madami na agad na breast milk. Actually, we just need a few drops to about 1 teaspoon per feeding for the first few days. So konting-konti. So the mothers and the relatives of the mothers usually have that same concern na wala pang milk. So ang iniisip nilang milk kasi yung puti na madami, voluminous. Well, yung tinatawag nating colostrum, that's the first few days. Few drops to 1 teaspoon. So baka naman yung mother na yun ang iniisip niya na yung madami. So latch lang tayo ng latch. And eventually after 3 days, that's when you have the lactogenesis 2 na madami, voluminous talaga yun.
Masakit naman, sobrang dami.
So, but of course, you have to check and also check for hypoglycemia kung hindi talaga pinalatch ni mommy. So hindi naman pwede yung ganon. So 12 to 18 hours we have this we check the baby kung yung activity, of course, tapos kung maganda pa rin yung cry niya. So makikita natin baka may problema kung
I think the baby was so stressed kasi the hospital was insisting na you have to feed the baby na. The hospital was insisting, kaya lang ayaw ng nanay. 3 days or 4 days na. Doktora, anong mga bad effects ito
kasi
sa bata?
extreme kasi no, may mga na ayaw talaga, but the doctor, yun yung step 2 natin. There should be training of health professionals, OB and pediatrician to be able to support this mother. So kailangan alam nila what's going on, kung kailangan na ba mag-supplementation or hindi. Kasi there's very few, 5% lang ang nangangailangan ng supplementation, but of course we realize na meron talagang those 5% na kailangan din mag-supplement. So, we have to be able to know that, hindi yung extreme na, kung hindi ayaw talaga, di ba? So, baka naman may problema. So, yun yung natin. Meron naman tayo.
Some flexibility.
Yeah. Oo.
So, kawawa yung bata 3 to 4 days.
Yung criteria natin kasi for yung chine-check natin sa hospital, exclusive breastfeeding rate, that's from birth to discharge. So 75% yung kumbaga ang grade dapat ng hospital for that. So naiintindihan namin na mayroon talagang percentage na hindi nagbe-breastfeed for whatever reason. Kung gusto ng mother na ayaw niya talaga, then a hospital shouldn't really insist kasi ayaw, that's the mother's right. So, they just have to put it down in the chart and document it.
Or minsan meron talagang reasons, no? May mga babies na who have medical issues na pwedeng hindi talaga maka-breastfeed.
Tingin ko dangerous.